Welcome to another episode of the MEGIN Spotlight series. We are delighted to have two guests joining us today from the Helen DeVos Children's Hospital in Grand Rapids, Michigan. Dr. Angel Hernandez currently serves as the Division Chief of Neurosciences, and Dr. Paul Ferrari, the Technical Director for MEG at the Helen DeVos Children's Hospital. Hello, Angel and Paul. Thank you for joining us today.
Thank you for the invitation.
Thanks for having us.
Just to give our audience some background about the hospital, the Helen DeVos Children's Hospital is a 234-bed regional referral center and teaching hospital based in Michigan. It offers advanced pediatric specialty care with more than 300 pediatric physicians who practice in more than 50 pediatric specialties and programs. The hospital is Michigan's largest neonatal center and is ranked as one of the best children's hospitals by US News and World Report. The launch of the Jack H. Miller Magnetoencephalography Center in November last year has been an exciting time for you and the team, as it offers MEG as an important diagnostic technology to people in West Michigan and beyond. So let's start with our first question for Angel. How will the center and its state-of-the-art technology prove helpful for neurologists and neuroscientists with the diagnosis and treatment of epilepsy and brain tumors?
Well, thank you for that question. The MEG will be very helpful in localizing epileptogenic areas and especially networks non-invasively, which will in turn help reduce the number of intracranial recordings and decrease the number of electrodes we use intracranially. Due to MEG excellent spatial and temporal resolution, we will see improvement in the accuracy of mapping different eloquent parts of the brain, especially in those patients with brain tumors, and especially those with brain tumors and epilepsy.
Paul, would the newly installed MEG Center be used for clinical use, or will the technology assist in any planned research projects in the future? And if so, are you able to disclose and share any plans for such projects?
Yeah, well, the main utility of the MEG and the inception of it was to be applied in presurgical mapping in epilepsy patients. But we've actually, in our 3 months, have already started to form scientific relationships with the clinicians, the epileptologists, the surgeons, to integrate more advanced MEG analysis methods and MRI analysis methods into their practice. And we're discussing research projects right now centered around this. Naturally, it makes sense for us to continue some of the work that I had started in my prior laboratory, where a couple of the projects were centered around speech motor processing and using those signals for a brain to speech interface using AI and decoding methods. So we're going to continue some of that work here with those colleagues in Austin. We were also using MEG to track the mechanisms of TMS modulation and neuromodulation for the purposes of enhancing sensory motor function. So we're going to we're also trying to get a TMS machine here, and we will probably use that in similar research projects and look at targeting rehabilitation in motor dysfunction. Beyond that, we're actually also affiliated with Michigan State University, specifically the medical school. And so eventually, after we get all of our logistics in place, we're going to open up the lab to collaborations for research investigations with the broader university community.
So how and why was the decision made to utilize MEG technology to solve neurological problems of patients at the Helen DeVos Children's Hospital? And Hel, perhaps you can give us a bit of insight to this.
Yes, absolutely. So we have a very busy pediatric epilepsy surgery program, but we also have a very busy adult epilepsy surgery program with increasing numbers of referrals for MEG. And due to the large referrals, we made the decision to acquire an MEG, but this decision was made primarily due to our patients having to leave the state to obtain an MEG. So this decision was actually quite easy to make when we have two very busy programs. And and also thinking about our patients and our population in West Michigan having to go out of state for this type of test.
So have you seen improved clinical outcomes from using MEG pre-surgical mapping? And if so, are there any specific cases that you could share with us that would illustrate how MEG was vital in the diagnostic process? Angel?
Yes, so we have had several patients in which the MEG has changed the surgical plan. We try to do many tests pre-surgically in order to have a surgical plan in mind. But the MEG has been able to change several surgical plans due to its findings. And I will just give you a couple of examples that come to mind. One was a child who presented to the emergency room here at Helen DeVos Children's Hospital after a seizure and was found to have a left temporal brain tumor. In this case, it was very important to be able to map where the seizures could be coming from and its relationship to the eloquent areas in the brain in the dominant temporal lobe. We were able to localize where the epileptiform discharges were located, which were right posterior to the brain tumor and superior to it. We're able to find the brain tumor had some auditory cortex. So this information was invaluable to the neurosurgeons when removing the brain tumor. I'm happy to say that this patient is doing quite well and thus far have intact hearing and understanding, which we're very happy for. Another patient that came to mind was a very interesting patient with a history of reading epilepsy. And these patients, every time they open a book and start reading, they will typically have a focal seizure or focal secondarily generalized type seizure. This second patient had an MEG and also was very invaluable in that we were able to localize an overlapping epileptogenic area right where the area in charge of comprehension and was located. So in this case, this patient will have a responsive neurostimulator implanted to control their epilepsy. So these two cases were good examples of that have helped us change our surgical plan and with hopefully good success with patients.
Thank you. So Paul, what are the future plans for MEG utilization at the Helen DeVos Children's Hospital? Are you planning on applying or expanding MEG technology in other areas as oncology, for example?
Well, generally, our plan is to use MEG as a centerpiece of a broader non-invasive brain mapping program that will include not only MEG, but quantitative MRI and TMS and maybe other modalities. As I alluded to before, we want to push the utilization of advanced MEG methods for clinical diagnostics in pre-surgical applications. This will include doing things like exploratory post-surgical MEGs, TMS, and MRI to track the surgical outcomes, the recovery and the rehabilitation process. Since you mentioned oncology, we already have referrals from oncology physicians, as Angel noted one of our cases. But as epilepsy pipelines get settled, we expect those referrals to increase. Radiation oncology is also an area that we may see an increase in utilization for too.
Okay. And then from your perspective as a technical director, what do you see are the biggest challenges facing MEG technology in the next 5 years?
Well, there are numerous challenges, some old and some new. In the U.S. specifically, the discussion has been perennially, about finding new reimbursable applications. The limited utility of MEG sort of creates this circular problem of not enough finances and education. So those are issues that continue to be, things that our groups try to solve. And there's been a lot of good, great research out there. on diagnosis of various neurological diseases such as Alzheimer's, TBI, and dementia and autism. But I think we also should not shy away from using MEG as an adjunctive diagnostic, for example, as a way to select responders for various therapeutic approaches or for dosing those approaches. But the new topic on a lot of MEGers these days is the OPMs, or optically pumped magnetometers, aka wearable MEGs. These sensors have the ability to change the landscape, both in sort of distribution of MEG because of cost and the sort of greater utility they have. But the technology is changing vastly, and it'll be interesting to see where we are in 5 years with that.
Yeah, absolutely. Thank you both, Angel and Paul, for your time today. It's been really informative for our audience, and it's an honor for us to be able to share insights into MEG utilization and, in such a prestigious and advanced institution such as yours. And to communicate this with the wider MEG audience globally is exactly the aim of these spotlights. So thanks again for your support and your time today.
Thank you for having us.